Good morning, everybody. It's Wednesday, the 10th of June, and welcome to our COVID presentation for today. We're going to start this morning by, rather than looking at the specific numbers for the community, just talk a little bit more globally about what's happening and what the numbers are telling us. For the last week, as we have been talking, we've been looking at the developing trend lines and noticing an increase in the number of cases, even though the fatalities in the state and in the United States are declining. Florida has two things that have happened that I wanted to share with you here in Florida. We have now had 5 consecutive days where we had more than 1,000 new cases reported in a single day. And we are one of 14 states that has now had a 7-day average that is the highest average increase of cases for a 7-day period since the beginning of the COVID back in February. So the last 7 days in Florida and in Pinellas County have not been particularly good. As cities and states across the nation are opening up, we're going to see an additional increase in the spread of this virus. There are going to be more opportunities for exposure, both with people who are leaving the campus, going to visit with friends, families, going shopping, to physician appointments, as we begin to allow visitors into the community, even though we're limiting it to exterior outdoor spaces at the moment. All of these additional risk exposures are going to create heightened numbers here at Regency Oaks and in the county of Pinellas and for that matter, the state of Florida. So the governor is considering a delay in the phase 2 before he is able to go to the next step. You know that originally these phases were designed to last 14 days. Our phase 1, instead of being 14 days, was a little over 30 days. Phase 2 is designed to be 14 days, and what we're hearing is that phase 2 is very likely to go at least 30 days as well. And it's all because we're seeing an increase in the number of exposures as we start to reopen. Preventing coronavirus or the spread of disease is really, really simple. And that's why today what we've decided to do is to go back to our original COVID presentation that we did at the end of February. It has basic information of an educational nature, and it's just, we felt, really important to go back and take another look at the basics, because this disease is preventable, it is controllable, but there are measures that you can take to help keep you safe and your neighbors safe. So let's go to our presentation. This is back from February of this year. All right, this was our COVID town hall meeting from back in February, and we started by talking about the risk of getting COVID-19. Back then, the risk was pretty low. That obviously has changed. What has not changed is how the disease is spread. This is primarily a person-to-person spread, and it comes from being in contact with someone who is symptomatic. If you are around someone who is coughing or sneezing, you need to be very cautious. That is how this disease is spread. It is possible that you can catch the disease by touching a surface or an object that has previously been touched by someone with COVID, and then in turn you turn around and touch your mouth, your nose, or your eyes. But that is not the primary means of how this virus is spread. There's been a lot of talk recently about asymptomatic spread. And at one point early on, they had talked about that representing a very large percentage of cases, new cases, would be asymptomatic spread. People who had the disease and didn't know they had the virus and exposing others. The more recent information we've seen from both the World Health Organization, they've backed off on that a little bit, but we're also seeing it from CDC, is that asymptomatic spread is not going to be a primary means of transmission. It is possible that someone can be walking around totally oblivious to the fact that they are a COVID spreader, but they are getting closer to determining that that again is not a very likely scenario. It is people who are symptomatic, people who have flu-like symptoms. Those are the ones that are spreading the disease, certainly not intentionally, but that's where the risk factors lie. Also, you should be very careful about being around or exposed to people who have traveled to places where others have been exposed to COVID and have gotten ill. And then most importantly, if you have an underlying health condition or are elderly, you are at a higher risk. And so it takes a higher level of personal accountability to keep yourself safe. Knowing the difference in the symptoms of flu versus COVID-19 is really important. COVID-19, it begins to show somewhere between day 2 and day 14. It has a very high fever, at least 100.4, a severe cough, one that rattles in your chest and is painful. There is shortness of breath, muscle aches, fatigue, and abdominal pain. And the symptoms are significantly different from flu, primarily in two areas. It's a low-grade fever with flu. It's going to run somewhere between 98 and 100, and then there is a sore throat associated with most flu. Being able to diagnose this early is critical to early intervention and regaining your health and preventing a fatality. So if you are experiencing COVID-19 symptoms, it is important that you seek the attention of medical intervention, either your physician or your ER, local hospital, early so that they can immediately get you on medications and begin treatment. It is also really important that you continue to have your temperature checked on a daily basis. You can do it in your apartment. It's important that you log that temperature and you're looking for trends in increase in temperature over 3 consecutive days. But you also can come down to either front desk and we are taking temperatures, logging it, and monitoring it for you. Early intervention is the key to beating COVID-19. Prevention. This is the most important slide up here. Here is how you avoid COVID-19. Wash your hands with soap and water for at least 20 seconds. We did a demonstration a couple of weeks ago on the proper techniques to thoroughly clean your hands. That is how the disease is spread, and it is not the exposure on your palms or the back of your hand that will cause the exposure. Our hands, our skin is a perfect barrier, and the virus does not get through the skin. The virus is spread when the exposure happens on the hands and then you touch your nose, your eyes, or your mouth. If you are coughing or sneezing, you shouldn't leave your apartment. If you are coughing and sneezing and you do leave your apartment, you should cough or sneeze into the crook of your elbow. That's really important because it's the droplets that you are projecting and creating the airborne spread of the virus. If you have disposable tissue, throw it away. One use, throw it away. Don't stick it back in your pocket. Immediately discard it and then disinfect your hands. If you're not sick, you don't need to wear a surgical mask. This has changed, and the advice now being given by CDC and the World Health Organization is if you are sick, you should wear a mask. If you are not sick, but in common areas or public space, and you are in a at-risk category, you should be wearing a mask. It does not need to be a surgical mask unless you are in a high-risk category. A cloth mask will work just fine, and it is now recommended whether you are sick or not, if you are in public spaces, you should be wearing a mask. Keep your distance from people who are sick. Again, if you're sick, you should be in your apartment. But if you see someone out and they appear to have symptoms, they are coughing, they are sneezing, keep your distance. I was in line at a Circle K earlier this week. I'd stopped to get a soda on my ride into work, and there was a lady in line, 2 people back, who was coughing and sneezing. I literally got out of the line, put my soda aside, and I walked out because it's so important to avoid people who are ill. Avoid touching your mouth, your nose, and your eyes. Wash your hands frequently. Keep your hands off of your face. I know it's one of those habits that we don't even realize that we're doing. And so you just need to be conscious of avoiding touching your mouth, your nose, or your eyes. Stay at home when sick or limit contact. Now, I know I've said that 8 times already, but that is so important in helping us control the spread of this virus. Disinfect frequently touched objects and surfaces. So Jesse and our housekeeping team, the majority of their day is spent on this task, whether it's elevator buttons or door knobs and handles, or just disinfecting the hallway areas that people might touch, like tabletops and sign-up sheets and pins and front desk. We're constantly working on disinfecting. You should be doing that in your apartments as well, particularly the faucet knobs and the things that you touch on a routine everyday basis. The RO task force, our daily COVID meeting, we meet every single day to talk about the numbers and our processes and what's working well, what we can improve upon. Our housekeeping is working on disinfecting. Our maintenance team we still participate in the daily coalition meeting with the Department of Health. We get our updates from CDC, World Health Organization, Leading Age, and the Center for Medicare Studies. Our food and beverage, we're completely stocked with our emergency food supplies, meal deliveries, paper products, PPE, the personal protective equipment. Our human resource is working with our teams to make sure that our associates are safe. We're working on education with our residents. We do the daily 5 thoughts, which are now pretty much education oriented. And then Nurse Diane, even though she is not able to diagnose this or treat you, it's a critical role in helping to make sure that you continue to practice safety, and she can assist in making recommendations for next steps if you need to go to a physician or an ER or an urgent care. So we will continue to focus on that as well. Okay, so that was our presentation from back in February. Everything that we thought then, pretty much we still continue to believe now. Here we are 3.5 months into this. Here's my final message. It is getting worse out there in terms of the spread of COVID. More people are going out and about. We're going to have more exposures here at Regency Oaks as we open up. We're all moving forward. The state is moving forward. The country is moving forward. Pinellas County is moving forward, and we're moving forward here at Regency Oaks. We're going slow. We're being careful. I know that many of you think we're going too fast. Many of you are concerned that we're not going fast enough. We are trying to be cautious because we recognize that we are dealing with a high-risk population. We are trying to be cautious because we're looking at the numbers and we're seeing that the trend line is currently going up, not down. But here's what I can share with you. We're committed to moving forward. I don't think life is sustainable like this. I know residents are tired and they're sick of this and they're wanting to get back to their lives, and I understand that. We support that, but we want to do it in a manner that is safe and doesn't take unnecessary risk. And so I'm very appreciative of your understanding and of your support. We could not do this without the support of the residents, because each of us play a role in keeping our neighbors safe and preventing the spread of COVID-19. So every couple of days, we are rolling back further restrictions, and we are slowly, carefully, methodically moving forward in a safe manner that will keep all of us protected and prevent the spread of COVID-19. Hope you have a great day, and we'll see you again on Friday.